So after that, now we're going to focus on some of the joints. So one of the main joints that gets really stiff after a total knee replacement is the kneecap here. So this kneecap's a floating joint. It floats all the way down and up when we bend and extend our knee. And if that gets stiff, that can really impact our movement. So again, keeping the knee relaxed, you can even kind of prop a pillow underneath just to make sure the knee is, the muscles around the knee are not contracting, because that can limit our success with this next technique. So what we're going to do is take our fingers, we're going to find both sides of the kneecap, one on the inside, one on the outside, and what we're going to do is just wiggle this knee side to side. And you should feel some motion. It should glide side to side. If it's really stiff, make sure you're relaxing your quad muscle. Make sure it's nice and relaxed, because if it's too tight, you're going to notice when you go to do this, it just doesn't move. We want the muscle to relax so that the joint can move well. And so you can apply as much pressure as you comfortably can. This is a great way to loosen up the kneecap. Like I said, if it's restricted, it's really going to fight your ability to flex and extend your knee. And we're just going to wiggle the kneecap, I would say, for 30 to 60 seconds. And we're just trying to get this as loose as possible. Recovering from a total knee replacement or getting ready for surgery, rehab can be confusing. You're not sure what exercises to do, when to push, or how to manage pain and swelling. That's exactly why we've created the Total Knee Replacement Rehab Guide, a step-by-step plan to help you reduce pain, regain motion, build strength, and move more confidently again. Whether you're working with a physical therapist or going at it alone, this guide gives you a clear roadmap so you're never left guessing. Click the link to get instant access, and let's make your recovery smoother, smarter, and more successful. Now we can also go up and down, and so we can take our fingers, and my index finger is going to be on the bottom of the kneecap, my thumb's on the top, and if your incision's still healing, what I would do is just to kind of avoid the incision itself. So we're going to be on both sides of the incision, and now we're just going to wiggle up and down. And I'm trying to take up the skin, because sometimes the skin will slide too much. I really just want the kneecap going. So I want to try to minimize any sliding of the skin and get the joint moving up and down. And the same deal, 30 seconds to 60 seconds. Now, a lot of people are going to have a lot of swelling as well. So if you have a significant amount of swelling, it might be hard to find the kneecap, which is okay. Do your best. You can work through some of the swelling as well, but it just might not be as accessible.